All right, it is Workforce Wednesday. Welcome, welcome, welcome. Thank you for joining us again. My name is Anissa, and I'm your host, and we are wrapping up our Workforce Wednesday sessions. We have like three more left, guys. And so I heard you all when we spoke about who do you want to hear from, what professions, what backgrounds, and healthcare was one of those main industries. And so we're super, super, super blessed to have with us Mr. Hamid Dawson. He is currently a business operations coordinator at UNC Health. He has a decade of leadership experience in healthcare management. He achieved his Bachelors of Science at the Winston-Salem State University. And of course, he was a student athlete. He spent most of his years in NC by way of North Carolina. He's a single father and an entrepreneur of an established home improvement business. His principles in life: love yourself first, finish what you start, and discipline and balance is the key to life. And so truer words have never been spoken. I've known Mr. Dawson for the greater part of a decade, longer than a decade, and all that he says is true. Very accomplished man, fantastic father, and a phenomenal friend. And so thank you so much for joining us and coming to impart your wisdom and dropping your jewels on our participants. And the floor is yours. So snaps for Mr. Dawson for joining us this evening. He's on the East Coast. It's almost 9 o'clock at night. You know, old people go to bed early. So, this is right before his prune juice and bedtime. So we thank you for joining us, and the floor is yours.
Listen, it's a pleasure to be a part of this campaign here that you guys have. I think it's an excellent tool. And just so you know, it's not bedtime for me. I'm going to hit the gym right after this, okay? I go hard in the paint. I'm for sure about mine. Hey, listen, guys, my name is Hamid Dawson. Needs to introduce me. And, I like to just, I do a lot of public speaking, and a lot of times I feel like the best way to, connect with everyone, just have a conversation. So I don't want you to feel like I'm talking to you or at you. Let's just have a conversation. I'll tell you a little bit about myself, and if you guys can do the same, and we can just have a conversation about the things that interests you, that you are trying to achieve, and things like that. So, name is Hamid Dawson. I'm originally from the Bronx, New York, like Anissa said, and I made my way to North Carolina for higher education, and also take care of my family too. So there's a balance, right? Balance of life. And a lot of times in life, we don't quite know why we're led to certain places, but it all unfolds, and when it unfolds, you're gonna be like, oh wow, like this is what it was all about. I went to Winston-Salem State and got my degree in exercise science and sports medicine, Bachelor of Science. And I'm gonna tell you something. I'm gonna be honest with you. It was a struggle trying to find a job. Coming out of college, trying to get those odd end jobs. I was out of work for about 2 years and just trying to figure out, man, what am I going to do? And I had some challenges. I went back to the books and figured out, some things that I can get into. Cardiac rhythm interpretation was one of them. I took a class in that in my undergrad year, and I Googled jobs that hold that title, and I found one at UNC Health, Chapel Hill. And so I applied for a job. I gained the job, and I think what it was the most that kind of really gave me that elevation was my hunger. I was hungry. I was thirsty for just wanting more because, being out of work for 2 years, it was hard, it was rough, and I didn't want that for myself, nor my family deserved that, and I wanted to fight for something. So, when I got the job, I was hungry, I was thirsty, I was working extra. I mean, just learning as much as I can, and I was always a people's person. I'll tell you one thing about life is skill is one thing, but having the social capacity to be able to talk to people and be able to bring out the best in people and just be a social person, it helps out tremendously. And if you're not a social person, find out what your niche is and just bring that to life. So I continue to grow, and I was put in leadership role very, very quickly the first 3 years. Several of those years was management. and then now business operation coordinator. So I've been at my job at my institution for 16 years. So definitely an accomplishment because consistency is hard. 16 years is a long time. I mean, just imagine 16 years, same place, same people, So it's the drive and the push and the want to do more. And I'm gonna tell you something, I was happy. I was good at what I was doing. And at a young age, home improvement was something that was taught to me. And surprisingly enough, I had a situation where I needed to apply those skills, and so when I did that, the feedback was just like, Hamid, like this is amazing. Like start your business, and I'm like, nah, I'm not going to do that. Don't be afraid to take a leap of faith and just do it. Okay, what's that? Nike check. Just do it, right? Just do it. Hit it, right? So I started my business, and I started off slow, and for the past 3 years now, it's going well. I just I purchased a vehicle, a truck, a trailer yesterday, just yesterday. I got my first big job coming up this week where I'm renovating a whole entire house from top to bottom. So just continue. I think the key to, like I said, success is the balance of life, discipline, and sometimes just take the small steps. The small steps are just as important as the big steps because sometimes we try to take the big step too soon. You can't you don't have nothing really to like the foundation's off. So take the small steps and then kind of just push from there. So that's a quick intro of just me, myself, and just how I came to be. Um, if you guys have any detailed questions or anything like that, please let me know. But if you guys just want to tell me a little bit about yourself or any question, any challenges that you have, how can I help?
I have a question, Hamid. I actually want to back you up a little bit because I know you shared that you found a job in cardiac rhythms,
Yeah, cardiac surveillance, rhythm interpretation.
surveillance, cardiac surveillance. Can you tell us
Yeah.
more about that? Does that require a 4 year degree? Is that just like a certificate training that folks can go and get? Or what all did that role require? I know it's a plus, definitely that you already had the degree and you had already had a class, but is that something that if someone is interested in, they can just go and get training for and learn to do the role? Can you tell us more about what that role looked like?
Yeah, that's a great question, Lisa. And I'm gonna tell you, in healthcare, a lot of times they ask for you to be certified or licensed, but there are jobs in the healthcare field where all you need is a 6 week class, 6 weeks. And this job in particular, 6 week cardiac surveillance rhythm interpretation class, 6 weeks, right? And so for myself, I got my bachelor's, but the requirements was 6 week class, and will then apply. Then when you're hired, just pass your competency exam, and you can get started. And I kind of want to pivot a little bit and just talk about how you know to get into any field in life, healthcare or whatever you want to do, don't think you have to start out so big just to get in, right? And I say that because when I was working at the hospital, there was a environment service tech, right? Someone who cleans the house. I mean, sorry, cleans the patient rooms, right? Right. And so this lady was like, she wants to, you know, level up, as the young kids say, right? So and I told her, and we had a conversation, and she went to school to get her nursing assistance, like certification, and I loved her job. I hired her as a nursing assistant. She helped out and supported. And then a couple years in, she wanted to actually to do the cardiac part of it, like read the rhythm interpretation. And so, because she had hands-on in that department, I trained her a little bit, and she went off to take that 6 week class. Same thing like CNA, 6 weeks. And then so she took that cardiac class 6 weeks, passed it, and came on. Now she's a card tech and she's been there for several years. So, coming in as, and I hate to use the word janitor, but coming in as an environmental, cleanup person to now reading heart rhythms, it's just it doesn't matter how you start, it's just getting in and just accelerating, and sticking to it. So yeah, great question, Anissa.
Nice. Thank you. So 6 weeks training is what it takes. And then, as you said, there are competencies as you enter the role. Of course, you want to always focus on upskilling. Favor, I think you came off mute. Did you come off mute because you had a question? We'll wait for Favor to pop on because I seen that she unmuted herself right after I asked. Oh, Favor, you sound like a robot. Say that one more time.
I said that the way I came off mute is because you said we should introduce ourselves. That's why.
Ah, okay. Introduce yourselves. Yeah, we can still do that too. We can still do that too if because I know Mr. Dawson said if you want to come off and introduce yourself and ask a question, please feel free. If you would like to, I'll hold space.
Hi, I'm Favorite. I'm almost 2016. Let's see. I have 4 siblings. I'm from Nigeria. Let's see. When I grow up, I wanna work with children. Um, what else? My birthday is in April, I guess, and I am born 2010. Yeah, I'm in 10th grade.
Thank you, Favor.
That's
Favor, you sound
excellent,
like
favorite.
a yeah. No, go ahead.
No, that's an excellent favorite. I love the fact that you want to work with children and you're in the 10th grade and you're trying to, push forward and see what that direction you want to go. And I think that's awesome. I think when I was in the 10th grade around your time, favorite, I actually volunteered at a hospital for you. It could be a daycare center during the summertime or summer school or anything in that arena, just to kind of get your eyes set on what it is in health and education that you want to do. So very similar in healthcare, right? The big things you think about is like doctor, nurses, like the big names, right? But there are technicians like ultrasound tech, cardiac tech, imaging tech. So same thing in like education, like the big thing is principal, teacher, right? There's administrators, even nurses, and other things in education that may spark your interest. So I love the fact that you want education, but also do some recons, do some volunteer work to see exactly like which way you want to go in education. And that way, when you get out of high school, you'll already be a step ahead because you have the visual and you kind of see exactly what you want to do. But I love that for you. Continue to grow.
Thank you, Favor. Thank you, Mr. Dawson. So I know Mike is on here. Mike, I'm kind of calling you out because I know Mike has worked in healthcare, doing some things. And so, Mike, I don't know if you want to come off mute and ask any questions, as I know you're always in the space of like upskilling and figuring out like how to better yourself or stretch your career. So if you want to come off and introduce yourself and ask any questions, please do. But if not, Mr. Dawson, we would like to hear more about your role in the hospital as business operations, because I think that's something that we don't often hear in hospitals. And what does that day look like? Like, what are your roles? What are your duties?
Yeah, sure. I'll give Mike the floor if he wants to chime in. What's up, Mike?
Yeah, what's up, man? How you doing? My name
I'm
is Mike.
good,
I'm
bro.
34 years old. I work currently in healthcare, but I'm doing I was doing patient transporting in the hospital, but right now I'm kind of doing like more in-home supportive services. But when you mentioned the cardiac monitor program, it kind of piqued my interest because I was taking a telemetry EKG program. I'm actually going to re-enroll because I needed the one that I took was self-paced 6 months, and I actually needed more time because the test was pretty hard. But Yeah, when you mentioned the program that you took and that it was only 6 weeks, definitely was interested in that because if they have something similar out this way in California, I would love to um, gain more info on it. More insight.
Yeah, for sure, Mike. And that's a good observation you made because we are in different parts of it's different state may have different rules and regulations and things like that.
Yeah.
So 6 weeks for me could be 6 months for you. I would say use your, it seems like, you're already in a healthcare setting. I would have you tried maybe like have any resources in that area that you can reach out to? I know as manager for me, I would bring in a lot of people who just wanted to shadow, and had dozens of people that were working as EVS or patient support, transport, etc. And they were very interested, like yourself, and they came in and they volunteered and they shadowed rather, and they asked many questions, and I allowed them to come in as many times as they wanted to. And I think during that time they talked to the technicians. Sometimes just by being around people who want the same thing you want, right? You just need that extra encouragement and etc. Not saying that you don't have it. I'm just saying that sometimes it's very it just gets you that boost. And so I would start there, brother, and just work your way through there and see if you can get some opportunity to shadowing and getting to know a few people. I tell you what, I did hire several people just by them coming in and shadowing, and they were very interested, and they were very clean, good people, just wanting to do better. And that's for me as a manager at the time. That was my passion to bring people up. You know what I'm saying? And I think if you show that, you can do that, but and also the resources are there, so if you're having some hard times, because those rhythms can be very complicated sometimes. That test is a beast. So I definitely understand what you're talking about, but definitely use your resource there, get connected with somebody, network, and man, try again. Just try again and see what pans out.
All right. Thank you very much.
Yeah, Michael, for
Appreciate-
sure.
Mr. Dawson, if you don't mind dropping in the chat the title of the role, I think you called it cardiac surveillance. And then Mike, we can look more into that. We do have another healthcare professional coming on who's been in healthcare over 40 years and has a pretty good connection to Kaiser. And so we can always
Okay.
kind of look through and see if she knows anybody in those roles. And we can kind of use our network, right, to build our net worth and make sure that we are connecting with folks. Mike, if you want to take that down, cardiac surveillance telemetry,
Yeah, I just finished. Thank you.
and we can go from there to see if there are any certifications or if those positions are available here in California, which I feel like maybe it might be titled something different, but definitely probably so.
Yeah,
Nairi,
definitely. Thank you.
not, do you have any questions?
No, I don't.
Okay. Miss Michelle, do you have any questions for Mr. Dawson? I know you just hopped on and you're stepping in, but if you have any healthcare related questions, please feel free to tap in.
My question. Well, one, I didn't get what area he was in.
Yeah, sure, Michelle. Hey, is it Michelle? Is that correct?
Yeah.
Yeah, I'm in healthcare management currently, business operations coordinator. So the area of the specific area is cardiac surveillance, otherwise known as telemetry, just EKG monitoring for inpatient, step down, and procedural areas.
No, what area are you located?
Oh, I'm sorry, North Carolina, Raleigh Durham area.
Okay. 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 Wonderful. Now let me ask the question.
Yeah.
So now this is a little different, but I would like to know, what do
Mhm.
you think brings a lot of people to your area? Like, what type of health issues, what are type of preventative measures could people use? But like, what do you see that's bringing people in having cardiac um, episodes and things like that.
Say that one more time. What I can't I said it one more time.
What
I'm
kind of
sorry.
problems? What kind of problems are people having that are causing them to end up in your department?
From the patient side of the spectrum or the technicians?
The patient side of the spectrum. I always
Uh,
like to hear about, like, if I hear a lot of people saying that vaping, for the young people, vaping is starting to cause a lot of different problems that are hospitalizing the younger generation. What do you know? Do you notice any trends? Because you see a lot of this stuff on social media, but do you notice any different trends in health problems that are occurring with this younger generation?
yeah, that's a tough question. I'm not 100% sure. I do know, heart disease is a number two killer, but I think for what I've seen in the hospital setting, it's some type of abuse, right? Drug abuse, alcohol. Um, you mentioned vaping as well. I have not heard of that, but I know there's studies out there who that is coming out in regards to that. For us, it could be just coronary heart disease, things of that nature, but nothing that comes to mind exactly like the what exactly causes, that what type of patients that we're seeing more of a volume of. I can't answer that question. That's a very great question, Michelle. I'm sorry, but I can't answer that one. It's a good question.
No, no, it's okay. I just, so I'm a life insurance agent, and I
Okay.
specialize in living benefits. So, you know, um, when people get critically ill with heart attacks, cancer, strokes, but we have just been seeing an influx of younger people having heart issues that are causing them to
Mm,
have strokes, that are causing them to have heart attacks, that are putting them into a critical illness state at such an early age, you know, um,
yeah.
and it's just one of those things where that's what really triggered the question, So I always try to make sure people have those living benefits, because if you become critically or chronically ill, or you have a condition, that's going to cause you not to be able to perform your daily duties on work. I make sure that people already have living benefits in place for the what ifs of life. But I've just noticed that there's been a rise in the what ifs of life being related to heart conditions. So that was my reason for asking. But yeah, no,
Yeah.
it's definitely a difficult question. But I was gonna throw it out there. Don't worry, it's okay. It's okay.
Yeah. I appreciate it, Michelle.
But I do
Thanks a lot.
appreciate your
Yeah.
expertise and your knowledge, and just sharing this information, because it's so necessary, especially also the representation that you're bringing to the table. So kudos to you. Great job.
Thanks, Michelle. I appreciate it.
So, Mr. Dawson, we're coming to the end of our session, but I heard you say a couple things, right? You talked about how you stepped into the industry in cardiac surveillance, and then sounds like there was some upward mobility and maybe some promotions and things. But even separate from that, you decided, hey, I have an additional skill set or a gift that has been given to me by God, which is your home improvement business. And now you just bought your first truck, so snaps for you, and you're about to rehab an entire house. And so, just in the last minute or two, what if some folks are interested in entrepreneurship? How do they level up? And like, what steps have you taken?
Man, that's a very great question. Still being in the beginning phases of my business and my career of home improvement, a lot of the things that I've gathered over the time is just knowledge, like asking questions, just be an ear, right? We have two ears, listen more and talk less, right? That's what my grandma used to always tell me. And just ask the questions and listen, and just being around people who have their businesses already, and they may not have a home improvement business, but maybe they have a boutique or restaurant or whatever the case may be. I think at the end of the day, if you have your own business, everyone is the same. They all are trying to make sure that their customer is happy, right? And so I take everything from every little piece of it, even Chick-fil-A. Everyone loves Chick-fil-A, right? And what's the number one thing when you leave Chick-fil-A after you done gave your meal? What they say to y'all?
It's my
Um,
pleasure.
it's my pleasure,
Pleasure to
right?
serve you. Yeah.
Pleasure, just those little tidbits that you hear and you apply it, right? And then that's how you build your brand. And so that's what I did. I'm always observing and making sure that I key in the things that work and ask questions. And that's it. And also understand there's a business side of to it. So just getting that person, that mentor to talk me through like insurances and taxes and things like that. Just because when you open up a business, you want to make sure that it continues, right? That you stay consistent with it, and you have to understand the business side of it as well as the customer service side. So I'm still balancing out those two. Like I said in the beginning, the key of life, balance is the key of life, and be disciplined. Be disciplined, and don't stop. And one other thing that my motto is, finish what you start, and that's it. Always finish what you start, no matter what.
Fire. You come on here dropping gems. I hear multiple streams of income. I hear finish what you start. I hear don't be afraid of growth. Don't be afraid of challenge. You talked about mentorship, legit businesses. And so there are so many jewels that you have dropped in these 30 minutes that we've been on the call. And so we are just so appreciative of your time because that's the one thing you can't get back. And you decided to hop on here with us and inspire and encourage. And so we appreciate you. So snaps up from Mr. Dawson. Okay, we wish you and we pray nothing but the best for you and your business. Now, listen, your girl got a mean popsicle house that I can build. I don't know where that fits into your company, but if you need like a little popsicle stick house, I'll even eat the popsicles myself. Okay, and I'll wash the sticks off and I'll glue them together. Okay, I'm a beast with a glue. Thank you so much for your time. Y'all give it up for Mr. Dawson, and we would love to see you
Thank
back
you.
in the future. If you have any questions, we can stay on a couple minutes. And if not, then you are dismissed, and we will see you next Wednesday. We have Lashina Wilson, CEO and founder of Sorbet. And then the following week, we have our 40-year nursing veteran, Dr. Doris Brown, who is a current labor
Ooh.
and delivery nurse, and she's going to come on and tell us all the great things about labor and delivery. So we got a good lineup coming up before we wrap. Our last session is April the 15th, y'all, and then we won't see each other until school starts. So love, peace, and soul if you have nothing else. If so, we'll hang back for you for a minute or two. You're welcome. Have a good night.
Bye. Oh, bye.
Bye, Favor.
Good
Have a great
night.
night. Happy
Guys.
Wednesday.
Wednesday.
Don't give
Hump
up.
day.
Let's do it.
All right. Miss Michelle wants me to connect you to Mr. Dawson. I can do that. She said, listen, get these patients what they need, okay? Indeed.
Sure.
Stop recording. Stop recording.